Tom, one more question. Okay. All our participants are in the webinar. There's no one in person watching this, right?
Yeah, everybody's in the webinar.
Okay, gotcha.
So we've got, it looks like we have 4 guests in here today. So thank you guys for joining us. We appreciate you dropping by. And again, thanks to everybody here at Henry Ford for helping us out. Henry Ford Health Systems, I should say the whole thing. I'm going to, at this point, I'll pass it over to Greg. Greg will kind of guide us through, introduce our different speakers. We're looking forward to it. So thanks again, you guys. Here we go. Thanks, Greg. Take it away.
Thank you, Tom. Welcome, everybody, to the Nutrition and Cancer Prevention webinar. It is Henry Ford McCombs and Henry Ford Health Systems' pleasure to be here. This is the most recent in a long series of health education events that we've done in partnership with the Sterling Heights Chamber and the Sterling Heights Community Center. We're usually in the community center doing these in person as part of the Senior Expo or the Health and Healthy Living Expo. And we hope to be doing those in the future in the beautiful new community center. But until everything is completely safe with COVID and everyone is vaccinated, we'll continue to work with Zoom to get you important health information. So with that, I will tell you that our speakers today are Molly Myers, registered dietitian at the Henry Ford Cancer Institute, and Donna Long, who is manager of screenings and tumor board at the Henry Ford Cancer Institute. The Cancer Institute has a new building downtown, beautiful new Brigadier Harris Cancer Pavilion, and some of those services are also available at the Henry Ford Macomb Hospital at 19 Mile in Clinton Township, which is a little closer to home for you folks. So with that, I will turn it over to Molly and Donna.
Alrighty, thank you, Greg. My name is Molly Myers. I am actually one of 4 oncology dietitians with the Henry Ford Cancer Institute. My coworker, Amy, she did the presentation on the 1st of July, and I am doing the presentation today. She is just one of 4 as well. This is just a slide showing Henry Ford downtown, the hospital, and then a photo of the new cancer pavilion. Basically, the role of the oncology dietitian is to help patients after they get a cancer diagnosis to, navigate their nutrition from start to finish. We work with patients when they get their diagnosis during treatment to navigate any side effects. And then we actually work with the patients in survivorship once they've completed their treatment as well. We also do presentations like the one today, just to educate the general public about different topics, especially nutrition and cancer prevention. So we want to...
I want to remind the audience, if you do have questions, please put them into the chat box and we'll answer those at the end to keep the presentations going. Thank you. Sorry to interrupt.
Nope, that's okay. Alrighty, so to get started, nearly 50% of most common cancers can be prevented. Eating well, staying at a healthy weight, exercise, quitting smoking or avoiding smoking altogether, protecting your skin, sunscreen and staying out of the sun, and getting vaccinated. The American Institute for Cancer Research came out with 10 cancer prevention recommendations. As we go through this presentation, we'll break down each of these 10 recommendations a little bit further. And it's the mission of the American Institute for Cancer Research, their mission statement is, we want to live in a world where no one develops a preventable cancer. And I'll just leave these up here for just a second so everybody can take them all in together. All right, we want to start out with being a healthy weight. There's strong convincing evidence that body weight increases the risk for pancreatic cancer, endometrial cancer, liver, renal, esophagus, breast, and colorectal cancer. There's strong probable evidence that body weight increases the risk for prostate, ovarian, gallbladder, stomach, and head and neck cancer. And weight gain later in life increases the risk of developing breast cancer. I think I skipped a slide. Okay. There are 13 cancers that are associated with overweight and obesity. So I'll just leave this slide up for just a minute so everyone can check it out. Another one of their recommendations is to be physically active. The American College of Sports Medicine recommends 150 minutes weekly of moderate intensity activity, which moderate intensity activity would be, walking briskly, vacuuming, sweeping your floors, or 75 minutes weekly of vigorous intensity activity. Vigorous being swimming, running, playing soccer, carrying, something heavy. For cancer prevention, they recommend 45 to 60 minutes of moderate intensity activity daily. And then doing strength training, 2 days a week. There's convincing evidence that physical activity decreases the risk for colorectal cancer. There's also strong evidence that physical activity decreases the risk for breast cancer. And these are just a few examples of forms of activity. The next recommendation is to eat a diet rich in whole grains, vegetables, fruits, and beans. And there are a couple different, going to the U.S. Department of Agriculture website, it's myplate.org. They recommend half of your plate being from plant-based foods. So whole grains, vegetables, fruits, legumes, filling up half your plate. The American Institute for Cancer Research has their recommendation for how to set up your plate. And you can find that at aicr.org. And they recommend 2/3 of your plate being plant-based foods. There's strong evidence that whole grains, vegetables, fruit, and beans decrease your risk for colorectal cancer. Limiting the consumption of fast foods and other processed foods high in fat, starches, and sugars. Added sugar consumption recommendations. For men, it is 9 teaspoons or 3 tablespoons. And for women, it's 6 teaspoons or 2 tablespoons. The recommendation for salt is no more than 2,300 milligrams. And they're moving towards an ideal limit of no more than 1,500 milligrams per day. And there's probable evidence that foods preserved by salting, like bacon, it increases the risk for stomach cancers. Another recommendation is to limit the consumption of red and processed meats. And basically consuming no more than 8 ounces per week to avoid the risk of increasing the risk of colorectal cancer. There's strong evidence that processed meat increases the risk for colorectal cancer, and there's convincing evidence out there that red meat also increases the risk for colorectal cancer. So basically, you want to eat little, if any, processed meat. We want to limit the consumption of sugary sweetened drinks. And these are pictures of just a few of the drinks that don't have any added sugar. There is strong evidence that consuming sugary sweetened beverages causes weight gain, which the weight gain then leads to being overweight and obesity. And again, as we've seen in previous slides, that's linked to quite a few different cancers. We want to limit the consumption of alcohol. For cancer prevention, it's best not to drink alcohol. But if you choose to drink, the limit is 1 drink for women and 2 drinks for men. And there's strong evidence that alcohol consumption increases the risk for liver, head and neck, and breast cancer. And there's probable evidence that suggests it increases the risk for stomach cancer. They also recommend to not use supplements for cancer prevention. They encourage eating the whole food. Again, the whole grains, the fruits and vegetables. There are some special circumstances where extra supplements are needed. If you've been told that you're deficient in a certain vitamin, then by all means, definitely continue to take that vitamin. Lots of folks are deficient in vitamin D. So they've been told by their doctor that they need to take a vitamin D supplement, and that's absolutely fine. But using supplements for cancer prevention, there is no evidence for that to support that. And then another one of their recommendations, if it applies to you, definitely breastfeeding your baby if you can. We know that there's strong evidence that breastfeeding helps her protect against breast cancer in the mother. And also another tip, breastfed babies are less likely to become overweight and obese. And overweight and obese children tend to remain overweight in adult life. After a cancer diagnosis, following our recommendations, if you can, seeking out the advice of a registered dietitian. Definitely consult with your surgical, medical, or radiation oncologist. They would be the ones to give a referral for you to see a registered dietitian. And like I explained before the presentation started, we're basically here to follow the patients as needed through their cancer journey from the beginning through to survivorship. And there are some additional lifestyle factors, like I talked about in the beginning, not smoking, avoiding other exposures to tobacco, staying out of the sun, and using sunscreen. They are also important in reducing cancer risk. They just get added at the end because they're not nutrition related. And following these recommendations, is likely to reduce your intake of salt, saturated and trans fat, which can help prevent other non-communicable diseases like diabetes and high blood pressure. And just an extra tip, if you're looking for healthy recipes, the American Institute for Cancer Research has tons and tons of recipes on their website. And it's a very easy website to navigate. So I definitely recommend checking out the recipes that they have on their page. And this is just the references for the presentation.
Molly, Dave from the audience had asked if you would go back to the sodium slide, please. I think he's got a question about something there.
Yep. Hang on. Let me get back in and back up my slides. Let me find that slide. It's further back than I thought. Okay. What was his question?
Dave, can you type in your question about the sodium slide, or you just want to look at the information again? Maybe that's the case. We'll wait to see if you have a question that pops up in the box.
Okay.
No question yet. Molly, maybe you just want to go over that material again?
I absolutely can, because I know that I stated from that slide that the recommendation per day for sodium is no more than 2,300 milligrams, and they're moving towards an ideal limit of no more than 1,500 milligrams of sodium a day.
That's his question. What are the recommended values again? I think you just answered that.
Yep.
Dave, I hope that answered your question. I'd ask you to wave, but I can't see you, but tell us if that answered your question. Yes. Bingo. Dave's happy. Thank you, Dave.
Perfect.
Okay. Any other questions on Molly's material? Well, before we go on to Donna. Okay, looks like we're ready to go to Donna. So you can still ask questions about Molly later too, if you'd like. Is Crystal Light good or bad? Is the question.
As far as cancer prevention, it's good because we want to avoid beverages that have added sugar in them. A lot of the juices, a lot of sodas have added sugar, and the Crystal Light does not. So Crystal Light would be a good choice, yes.
Unless you're like me, I can't stand the taste of those artificial sweeteners, so I drink the real stuff.
It definitely is an acquired taste, and some people can't do it. So in that case, then it's good to avoid the artificial sweeteners, but they've come a long way with them, so they don't all taste so bad.
I think I'm allergic because I get a headache as soon as I taste the stuff.
Some people are, yes.
Okay, is there another alternative?
Another alternative to
Crystal Light, I think. It says the question, is there another alternate? I think they're asked, yes, is there another alternate to Crystal Light?
There are quite a few different beverages out there that are without sugar and sweetened with different artificial sweeteners. And there are also, it's kind of a craze right now with those flavored waters. all different brands. Those also are a way to get the flavor without having the added sugar. So yeah, and you can always, if you want to cut down on the sugar, you know, if you do drink a juice or a lemonade or something like that, you can always, you know, pour yourself a glass that's, you know, a smaller amount and add extra ice to it or kind of dilute it with water. That's a good way to cut down on the sugar, but still have a bigger volume.
Any other questions from Molly at this point? She's not going to leave us. She can answer later. So if there are no other questions, calling once, twice, 3 times. Okay, we'll go over to Donna now. Donna's going to talk about screening and other good things related to cancer prevention. So hold your questions or put them in the box for either Molly or Donna. And Donna, take it away.
Hey, can you confirm? Can you see my screen? This cancer screening and prevention. And you can hear me good?
Can hear you, but we can't see your slides yet.
Okay, let me go back. Molly, did you hit stop sharing?
I did, yeah.
Okay.
There we go. Now we're good.
We can see it.
Yeah, we need to see your full screen now.
Hang on a minute. We need to get back to it. How's that?
Perfect.
Perfect. Okay, great. Well, as Greg said, my name's Donna. I'm the registered nurse manager for Henry Ford Cancer Institute. I oversee all cancer screenings and our tumor boards. Get forward. And this afternoon, we're going to talk just a little bit about the Henry Ford Cancer Institute vision and values, how you can reduce your cancer risk, different cancer screening guidelines, how to schedule your appointment, and then we'll have time for questions at the end. Excuse me, if you just want to go ahead and put them in the chat. So the Henry Ford Cancer Institute is committed to being the destination of choice for cancer care. We offer high value, state-of-the-art, technology advanced, seamlessly integrated supportive continuum of comprehensive precision care. That's a lot of information, excuse me, in one sentence. And basically, we have a hub and spoke model where each of our hospitals throughout Michigan can have access to the experts down in Henry Ford, Detroit, or other locations. So no matter where you go, where we have our blue and white sign, you'll get the same high standard of care. Cancer screening, I can't see on my slide. Can you hang on a minute? I'm sorry, I gotta move my view.
We can see them.
Yeah, but I can't. There we go. Cancer screening, our vision and values. So Henry Ford partners with physicians on cancer screening programs to detect cancer at its early stages and to navigate the patients through their optimal care, the right care at the right time. With our physicians' care values, we have easy referral process, we have better patient experience and outcomes, we have nurse navigators that help streamline your care, and we have a survivorship program. On the patient value side, we have, again, ease of access to any of our services. We encourage early detection because it improves the quality and longevity of your life. And our nurse navigators help take the fear and hassle out of any next steps for cancer care. Our team approach, again, our nurse navigators help patients schedule appointments and manage their care. And then our team of specialists, and Molly's part of this as a dietitian, meet weekly as part of our multidisciplinary tumor boards to evaluate each patient's treatment options and come up with an individual care plan for you. So what can you do to prevent and reduce your cancer risk? So in addition to having regular physical exams and appropriate screening tests, a lot of this is what Molly already covered, but just want to reiterate: avoid tobacco use, increase your daily physical activity, make healthy food choices, protect your skin from the sun, know your family history, and we'll talk a little bit more in detail about why that's so important in a few minutes, limit your alcohol intake, and maintain a healthy weight. So the 6th screening test. What is screening anyways? So screening is when you're testing for a disease when there are no symptoms or history of that disease. We have easy access for the 6 major cancer screenings: breast, cervical, colorectal, lung, prostate, and skin. So first we're going to talk about breast cancer screening. So about 1 in 8 women, or 12%, will develop invasive breast cancer over the course of their lifetime. Breast cancer is the 2nd leading cause of cancer death in women. Only lung cancer will kill more women each year. And the chance that you will die from breast cancer is about 1 in 39, or 2.6%. In 2021, we estimate just over 281,000 new cases of invasive breast cancer in the United States, and close to 50,000 new cases of what they call carcinoma in situ, which is non-invasive, so it's all encapsulated in one area of the breast. In recent years, incidence rates have increased by 0.5 or 0.5% a year. And although it is rare, about 2,600 new cases of breast cancer will be diagnosed in men this year alone. A man's lifetime risk of breast cancer is 1 in 883. So the screening guidelines for mammography is average risk women should discuss with their physician initiation of your annual mammography beginning at age 40. Screening should continue as long as your life expectancy is at least 10 years. Well, we know that we don't have a crystal ball to know what our life expectancy will be. If you are relatively healthy and don't have other comorbid conditions, hypertension, heart disease, kidney disease, diabetes, those type of things, we want you to continue having annual mammograms. So for women, if you have a personal or family history of breast cancer, dense breasts, or any questions about your risk status that potentially qualify you for high risk, talk to your physician. And here's a website here in the middle of the slide in blue where Henry Ford has different cancer risk assessments. You can go online and answer questions about your past medical history and family history, and it will calculate a risk of developing certain types of cancer for you. Besides screening mammography, women should have a clinical breast exam every 3 years if you're in your 20s and 30s, and every year at age 40. And beyond regular screening, it's important to report any breast changes to your physicians. Mammograms are available at several Henry Ford locations and the mobile mammogram bus pictured here. As we return to screenings post-COVID, our mobile coach is going out to more locations. Right now, the 4 locations listed here are where we have regularly scheduled our mammogram bus. So in a minute, I'll show you the number to call, or you can also schedule online to get your mammography. Some people prefer this over the brick and mortar building. You don't have to park and walk through the building. You park right outside the bus and you go right up and you get the same high quality 3D mammogram. Then we'll talk about cervical cancer screening next. Cervical cancer is most frequently diagnosed in women between the ages of 35 and 44. The average age of diagnosis is age 50. And each year, there's approximately 14,000 women in the United States that will get cervical cancer. It was once the most common causes of cancer death among American women, but the cervical cancer death rate has dropped significantly because we have increased use of a Pap test. This screening procedure can find cervical cancer early when it's small and easy to cure. Now, the human papillomavirus, or HPV, you may have heard of, is the main cause of cervical cancer. HPV is a common virus and it is passed from one person to another during sex. Most sexually active people will have HPV at some point in their life, but few women will actually get cervical cancer. The important thing to note is that female cancers usually cause no symptoms or they show vague symptoms until the cancer has progressed to an advanced age. This makes screening especially important. The cervical cancer screening guidelines are as follows. So women aged 29 to 39, every 3 years, you should have a pelvic exam and a Pap test. If you're 30 to 65, you can do every 5 years with a Pap test and include the HPV DNA test. And schedule a visit with your PCP or GYN for these screenings. Now for men, specific is prostate cancer screening. Prostate cancer is most likely to develop in older men, and in non-Hispanic Black men. About 6 in 10 cases, are diagnosed in men who are 65 and older. It's really rare to have prostate cancer under age 40, but it is not unheard of. The average age of a man diagnosed with prostate cancer is 66, and you have a 1 in 8 lifetime risk of getting prostate cancer. Prostate cancer remains an important cause of cancer mortality in men, with 34,000 deaths per year. It is the second leading cause of male death behind lung cancer. Whoops. The prostatic specific antigen is how we test for prostate cancer screening. We recommend that men make an informed decision with their physician about whether to be screened for prostate cancer, because the research hasn't proven potential benefits of testing may outweigh the harms of testing and treatment. And what I mean by that is, if your screening test looks for possible signs of cancer, but if they can't tell for sure if it's cancer and your test is abnormal, you'll probably need a prostate biopsy to know for sure. Here's the eligibility listed below for screening for prostate cancer. If you're age 50 and average risk, and you're expected to live at least 10 years. Age 45, if you're at high risk. The high risk people are African American and any man that's had a first-degree relative diagnosed at an early age. Younger than 65 would be considered a younger age. And a first-degree relative are your father or any brothers. Age 40 for men at even higher risk, and that's if you've had more than one first-degree relative diagnosed at an early age. Now, colon cancer screening. Colon cancer screening affects 150,000 men and women each year. Colorectal cancer, while it's the third most common cancer, is the second leading cause of cancer death. The rate of people being diagnosed with colon and rectal cancer each year has dropped overall since the mid-1980s. And this is mainly because people are getting screened and they're changing their lifestyle-related risk factors, especially diet is related to colorectal cancer. The downward trend is mostly older adults. Since 2012, the diagnosis rate has increased every year by 2% in people younger than 50 and only 1% in 50 to 64. Remember, screening can prevent cancer through the detection and removal of precancerous growths called polyps that can detect cancer at an early stage when treatment is usually more successful. The slow growth of a precancerous polyp to invasive cancer provides a unique opportunity for prevention and early detection of colorectal cancer. As far as the guidelines, colonoscopy is the tier 1 recommendation. We call that the gold star recommendation because you can identify colorectal cancer in its earliest stage and you can remove any precancerous polyps. It's an opportunity to actually prevent colon cancer. It's recommended that you have this screening every 10 years, provided you have a normal screening, starting at age 50 for average risk men and women. And because 10% of diagnoses are actually occurring in people younger than 50, some groups will recommend starting at an earlier age, like 45. An alternative tier 2 recommendation is a sigmoidoscopy or a CT colonography. Similar to colonoscopy, but it's only going to cover the lower part of the colon. CT colonography uses low-dose radiation to view inside the colon. It's recommended to do every 5 years. And remember, if you find a polyp, you're not going to be able to take it out using these methods. And finally, a tier 3 recommendation for people that are either unwilling or unable for a variety of reasons to do a colonoscopy, there are some home tests you can do. Cologuard and FitKit are different types of home tests that will detect tiny amounts of blood in the stool that could be a sign of colon cancer or large polyps. Cologuard is recommended every 3 years, and a FitKit is recommended every year. Again, these are less accurate than colonoscopy, and if you do have a positive result, the recommendation is that you have a diagnostic colonoscopy. If you noted any changes to your bowel habits, please contact your physician, even if you're not due or you've had a recent screening. Also, if you have a personal or family history of colon polyps, talk to your healthcare provider about when to get screening. The most important test is whatever one you will complete. The only bad decision is deciding not to get screened. So how do you schedule your colonoscopies? Henry Ford offers what we call open access. So it lets you schedule a colonoscopy without the need from a pre-procedure physician visit. So that means you only have to come in for one visit, not two, saving you time and money. To see if you qualify, you can call the number here on the screen. Well, let's talk about lung cancer screening. It's estimated that 235,000 new cases of lung cancer will be diagnosed in 2021. Lung cancer is by far the leading cause of cancer death among both men and women, making up almost 25% of all cancer deaths. Each year, more people will die of lung cancer than colon, breast, and prostate cancers combined. To no surprise, the causes of lung cancer include smoking, secondhand smoke, exposure to certain toxins, and of course, family history does have a role. Symptoms would include a cough, often with blood, chest pain, wheezing, and unexplained weight loss. These symptoms don't often appear until the cancer is advanced. But on a positive note, the number of new lung cancer cases continue to decrease, partly because people are stopping smoking and advances in early detection and treatment. Something else to consider in Michigan is radon exposure. It's the second leading cause of lung cancer, just behind smoking. The Michigan Department of Environmental Quality estimates that 1 in 4 homes will exceed the U.S. recommended EPA action level of 4. The radon test kits are available at your local health departments, relatively inexpensive. You can get a short-term test kit, which you place for 3 to 7 days and take it back for a reading for about $11. And the long-term kits that you leave for a few months is $30. And on the right-hand side here is a color graph showing the different counties in Michigan. The red zones here are the highest detected levels of radon. Orange is middle and yellow is acceptable range of zone 1. Now, lung cancer screening is recommended every year for current or former smokers, meaning you've had to have quit within the last 15 years and you're age 55 to 77. You've not had a chest CT in the past 12 months. You've smoked 30 pack years or more. A pack year is defined as 1 pack of cigarettes times how many years. So if you smoked 2 packs a day for 15 years, that would equate to 30 pack years. Or if you smoked 1 pack a day, you'd smoke for 30 years. And also show no signs of lung cancer. If you did show signs of lung cancer, the doctor would need to order a diagnostic CT rather than a screening. It's the gold standard for identifying lung cancer. Again, the early stage diagnosis leads to better treatment outcomes. And here again is just the list of symptoms of lung cancer. So why would you want to get screening in the first place? Lung cancer is often diagnosed when it's spread outside the lungs. 9 out of 10 people with lung cancer will die from the disease because it's found after it's spread. And again, if found early when the tumor is located in only the lung, up to 63% of the people will survive 5 years or more. And despite the very serious prognosis or outlook of lung cancer, some people with early stage cancers are actually cured. And Henry Ford does offer smoking cessation resources if you or a loved one does smoke, listed here on the screen at www.henryford.com, tobacco free. There's also the call number you can call here for tobacco cessation support services. The Central region, which is Allegiance Health out towards Jackson County, also has a smoking cessation nurse. And then there's the Michigan Tobacco Quit line as well. And summertime is perfect time to talk about skin cancer screening for Michigan. Skin cancer is the #1 cancer diagnosis in the United States. There's more skin cancer than breast, prostate, and lung cancers combined. According to the American Academy of Dermatology, more than 3 million Americans are affected by non-melanoma skin cancer. There's over 103,000 new cases of melanoma to be diagnosed in 2021. Now, melanoma is the most dangerous form of skin cancer. These are cancerous growths that develop when your unrepaired DNA damage your skin cells that trigger the mutations or the genetic defects. And that leads these skin cells to multiply rapidly and form malignant tumors. While melanoma accounts for only 1% of all skin cancers, but it causes the largest majority of skin cancer deaths. For skin cancer screening, the majority cases are caused by sun damage to skin cells and therefore largely preventable. Anyone can get skin cancer regardless of your skin color or race. Most skin cancer is a result of exposure to the ultraviolet radiation, which is strongest between 10 a.m. and 4 p.m. So we recommend that you use a broad spectrum water-resistant sunscreen that's at least SPF factor 30. And be aware that some medications can cause sun sensitivity as well. Here's a self-exam once a month at home following your bath or shower to look for any changes in your moles, blemishes, or birthmarks. The next slide I'm going to show you has a little bit larger pictures of these normal versus abnormal skin lesions. You want to look for asymmetry when one half doesn't match the other, irregular borders, color differences. You want even shades across the whole mole. If the diameter is bigger than the size of a pencil head, or if it's elevated, has high and low spots. Immediately, you want to contact your physician if you have a new growth or a sore that won't heal, or you have those small, smooth, shiny, waxy type lumps. Those you want to have looked at right away. And again, lower your risk by protecting your exposure to that UV radiation. Try to stay in the shade. Wear protective clothing, sunscreen, hats, and sunglasses. And here's a bigger picture of comparing. On the left-hand side here is your normal looking moles and skin lesions, and on the right would be ones that may appear to be cancerous that you'd want to have checked out. Here's the asymmetry. Here's the irregular borders. Here's the different colors. One side's darker than the other, and the diameter here is larger than a pencil head. So the good news is that 90% for a 5-year survival rate for melanoma when detected and treated in its early stages. And just an interesting fact to share with you is the number 9. 9 is the amount of times more likely you are to detect melanoma on yourself or others if you are a woman. Why is that? It's because men are less aware of the warning signs of skin cancer. Men are less likely to use sunscreen. Women use makeup, which tends to have an SPF factor in it now. And most interesting to me is that women's skin has more fat, which is protective, where men's skin is more collagen and elastin, and that makes it more susceptible to skin damage. Other reasons if you want to get screened. An ounce of prevention is worth a pound of cure. Some of these are just old cliches, right? Easier to treat. Abnormal tissue doesn't show any signs and symptoms, but by the time you have symptoms, it's much harder to treat because you most likely have more advanced disease. It would extend how long you live, give you a better quality of life, and it provides you the opportunity to make lifestyle changes if you noticed any early abnormalities, and it's going to tell your loved ones that you want to be there for them in the future. Here's how you can schedule any of your screenings. You can call 877-6-SCREEN, S-C-R-E-E-N, and we can help you schedule for any one of these 6 screenings. You can also schedule your mammography online through the mychart.hfhs.org. Also want to share with you COVID impact. Cancer didn't stop when we had COVID in the world. And we know that more than 1/3 of American adults have actually skipped their scheduled cancer screenings during the pandemic. As we saw weekly cancer diagnosis fall nearly 50% for the top 6 types of cancer during the early months of COVID. It's not because the cancer wasn't there, it's because people aren't getting screened. And the National Cancer Institute warns that drops in the screening for breast and colorectal cancer alone may lead to as many as 10,000 additional deaths in the coming decade. So it's time to return to screening. So at Henry Ford, we do screening safely. We schedule appointments to allow for social distancing between patients. Patients are screened for COVID-related symptoms as they enter our facilities before your appointment. Everyone continues to wear masks to protect both the patients and the staff. We have frequent hand washing, use of hand sanitizer by staff, patients, and visitors. We regularly clean and sterilize all of our patient areas and vaccinate. We continue to offer COVID vaccines to the community. Now, Henry Ford Health System also has COVID treatment available for high-risk patients. So if you've tested positive for COVID-19 and you're at high risk for developing severe illness or even being hospitalized, we can offer the monoclonal antibody treatment. To be eligible, you have had to have had a positive COVID-19 test, mild or moderate symptoms for 10 days or less, and 65 or older, or you're 12 to 64 with a condition that puts you at higher risk. That would be heart disease, lung disease, asthma, COPD, diabetes, those type of diseases. So let's crush COVID together. You can call the number here on the screen or go to henryford.com, crush COVID for more detailed information. And again, here's the eligibility for the one free visit, free treatment that's available at Henry Ford. And now we'll go to the chat and see if we have any questions.
Thanks, Donna. We do have a request to go back to the recipe slide for a question.
All right. I have those slides, so let me see if I can find that for you. Then we won't have to go over to Molly.
Thanks, Donna.
Let me get back to it. This one?
Dave, is that the one
you recipes for your website?
And I have the website. I can put it in the chat right now, too.
Perfect.
Okay, Dave, let us know if that's what you wanted in the chat box there. And any other questions, feel free to put them in the chat box and we'll have our experts respond to those questions. Here's the website. Is it possible to receive a copy of the slides? There is so much good information here, says Sue Steiber. And Dave, that is what Dave needed. He needed that website. So is it possible to get a copy of the slides? There is a lot of good information there.
I can send that. Greg, can I send it to you and you can get it out to our partners at the Commerce there?
Yes,
Okay.
Donna will send the slides to me, and then Sue, let's see. You know what? I will put my email in the chat box. That's my email, gjacob1@hfhs.org. So if anybody wants a copy of the slides, please email me and I will send out a copy of the slides to you. Other questions? Actually, I have one about smoking, Donna.
Sure.
I have heard that whether you're a young smoker, a middle-aged smoker, or a long-time smoker, it's always a good time to quit smoking because your lungs are able to get healthier anytime you quit. That's correct?
Yes, that's a true statement. They say that even within 2 days of stopping smoking, your lungs start to recover. Now, depending on how long and how much you've smoked, the damage, there is some damage that's never going to be repaired. But stopping smoking at any stage of life, no matter how long or how much you smoked, is beneficial.
Great, thank you.
You're welcome.
Sue says she cannot see my email address in the chat box. Can anyone else see it?
Yeah.
Okay, Sue, I'll try just to send it to you. I think it gives me the option to send it to you. All panelists. Oh, Steve cannot see it. That's weird.
It says to all panelists, do you have to do all participants?
All panelists and attendees. Okay, let me try it again.
There you go.
Okay, try that. Can you see it now? Okay, good. And another question, how significant, okay, Dave and Sue can see it, great. How significant is secondhand smoke for 24 years over 30 years ago to lung cancer? How significant is secondhand smoke for 24 years over 30 years? Do you mean age or to lung cancer? Or if you've been exposed to secondhand smoke for over 20? Yeah,
you're saying you've been exposed from 24 to 30 years? I guess it depends on the amount of exposure. Any exposure is going to put you at risk. And unfortunately, currently, the insurance guidelines from Medicare and other payers don't cover lung screening from secondhand smoke exposure. We know it's a risk. They may change their guidelines in the future, but right now you had to be a current or former smoker that stopped within the past 15 years. But if you have concerns or any symptoms, the coughing, wheezing, shortness of breath, that type of thing, talk to your doctor, because there are other lung CT or chest x-rays that they can order. It's just not a screening exam, but there may be other medical reasons that you'd want to be checked.
Okay. He says, I was exposed for 24 years ago, but it stopped about 30 years ago.
I would expect your lungs to be recovering, although, like I said, depending on how much you were exposed, you may have some irreversible lung damage, but we can't stress it enough. If you have any signs or symptoms, ask your doctor, because at this point, screening, again, is looking when there's no signs or symptoms, but the payer, Medicare, and other payer guidelines do not cover lung screening for people that have just been exposed to secondhand smoke. You have had to been a smoker yourself.
Okay, thanks, Donna. Any other questions for either Molly or for Donna? Questions going once? Going twice? 3 times? Okay.
All righty.
I think we're done with questions. With that, I will thank our experts today from the Henry Ford Cancer Institute, Donna Long and Molly Myers. I think they did a great job. Let's give them a hand.
Good job, Molly. Thank you.
And to our audience, thank you for joining us. We couldn't do it without you. And again, if once everybody is vaccinated, we hope to be back doing this in person at the Sterling Heights, beautiful Sterling Heights Community Center, which closed down right when cancer started, and I didn't get a chance to see it yet. So we're hoping to be there real soon. So
yes, we hope to be out and about in the community soon.
Great. And again, if you would like a copy of the slides, please email me, and Donna is going to forward those to me, and I'll make sure that you get them by email. So thanks again. Everybody have a healthy rest of the week. And if you have any questions or need any more information, just go to Henry Ford Macomb or Henry Ford Health Systems website, and there's all kinds of good information there, including phone numbers if you need to talk to a real person. So thanks again, and we'll see you soon. Bye-bye.
Bye, thank you.
Thank you. Bye.